Hi, everyone. Michael Herrick with HIPAA for Humans, realistic cybersecurity advice for healthcare. HIPAA enforcement kind of ebbs and flows. For a few years there, we weren't seeing an awful lot of enforcement activity coming out of the Office of Civil Rights. But I think that's really changing, and I think we're going to see some big changes in 2021. First of all, we've already seen an uptick in enforcement activity. During the last quarter of 2020, the Office of Civil Rights issued a number of enforcement actions to covered entities all over the country, not around data breaches, but in connection with the patient right to access their own medical records. So we're already seeing enforcement heating up. I think the new administration is going to bring some changes to HIPAA enforcement. There's going to be a new secretary of the Department of Health and Human Services, and the nominee comes from a law enforcement background. What's more, he's already familiar with HIPAA and has already, in his capacity as the Attorney General of the state of California, has already issued HIPAA enforcement actions against covered entities. Just in October, there was a multi-million-dollar fine against a national payer. They got hit by the feds and they got hit by the state of California. So the Health and Human Services nominee has demonstrated an understanding of HIPAA and a willingness to hold covered entities accountable for their obligations under the law. But I think there's some other big changes coming up that I think a lot of healthcare organizations are not prepared for. At the very beginning of the pandemic, Health and Human Services announced that they would be exercising enforcement discretion, by which they meant that they were not going to hold covered entities to the full letter of the law for new telemedicine technologies that they implemented at their organization. And as a result, a lot of healthcare organizations have started using non-compliant video conferencing technology, text chatting technology, and most recently, scheduling technology, online scheduling technology, without having the business associate agreement that is usually required. Now, Health and Human Services has been holding off on that kind of enforcement. They didn't want to stand in the way of innovation. They wanted to make sure that healthcare could move as quickly as we could to address the national emergency. But that, we hope, we're seeing the light at the end of the tunnel. And if what happens, if what we hope happens does happen, and we get through this with vaccinations and we get to that herd immunity state, those rules are going to start being enforced again. A lot of organizations aren't going to be prepared for that. It's going to catch them by surprise, and they're going to move into the new normal. You've got to be ready with compliant telemedicine technology when that comes. Down in the comments, I'm posting a link to a 1-hour webinar going into this issue in detail. You'll see, you watch this webinar and you'll learn what this means for you, what kinds of technologies are currently being accepted, but will no longer be acceptable when the national emergency ends. And I'm also in this webinar going to give you a full roadmap back to full compliance, step by step, what you should be implementing at your healthcare organizations so that you're ready for this when the rules change around HIPAA enforcement. I'm Michael Herrick with HIPAA for Humans, realistic cybersecurity advice for healthcare. Thanks for watching.